If you've got kids who wake up at night, who snore, or they're grinding their teeth, or have nightmares, wetting the bed, these are all symptoms that the brain is having a hard time while that person's trying to have good restorative sleep. We essentially heal when we're sleeping.
You're listening to Parenting with Impact, a podcast for parents like you, raising complex kids to become capable, independent adults, even in this complicated world. Each episode brings expert insights and real-life strategies to help you parent with confidence, calm, and clarity. Here are your hosts, Elaine and Diane.
Welcome back, everybody, to another conversation in the Parenting with Impact podcast. My guest is Dr. Marielly Mitchell. Did I get that right?
Yes.
Well, she's a PhD occupational therapist in the LA area. And today we're going to talk about sleep and brain development, basically. But let's just see where that goes. Marielly, can you tell us a little bit about what you do with families of complex and really how you came to be doing this work?
Yeah, absolutely. So as an occupational therapist, I work really closely with families and helping children thrive by connecting their brain and their body more, getting them more integrated from a sensory perspective and more coordinated from a physical perspective. And so sensory integration is kind of what really drew me into working with the nervous system. And then when I started to learn how breathing and sleep impact the brain development, it really caught my eye and was really fascinating to me. And I saw it day in and day out and through the clinic. And so I started to merge the worlds of traditional occupational therapy and the other therapies called orofacial myofunctional therapy, which is about the mouth and the tongue and most importantly, the airway. And so when a child has an optimal airway, they breathe well, they get enough oxygen, nitric oxide, et cetera, and their brain can fully function. And when they're not breathing well, like mouth breathing, that can have a really detrimental effect on their brain. And so I really honor that type of facet of development and principle of that to make sure that everything else can fall into place that we traditionally work on in occupational therapy, whether it's, regulation, handwriting, catching and throwing, feeding yourself, et cetera, because we work on a lot of different things, but you want to make sure the brain can process all that.
So, as a mom who's my eldest kid is 30, all right? So I had lots and lots of years of occupational therapy in my realm for lots of different kids and different reasons. And so before we hone in on the orofacial, myofacial, which I think I got right.
Yeah.
I want to help parents understand what's the correlation between occupational therapy and complex kids. So for me, what I remember learning was there's a vestibular system and a proprioceptive system. And my friend who's an OT used to get really upset when I'd say, I don't know, it's voodoo, but it really works. So
Yeah.
So a lot of our kids with complex needs benefit from a wide range of occupational therapy support, as you described. Can you kind of give us the broad base of why is it so important to kids who are struggling with ADHD, autism, anxiety, etc.?
Yeah, absolutely. So if I can show you a visual really quickly, I think this.
Yeah.
So this is called the hierarchy of learning. And
Okay.
so I've adjusted this, but what this is a triangle that kind of shows you how the nervous system and the brain and the body connect. And so I've just added here things that I think are really important, but what occupational therapy works on is really this middle of this triangle and the sensory processing at the bottom, which is really critical for you to have sensory integration that leads to regulation and coordination. And so a lot of our children with ADHD, ASD, et cetera, or coordination challenges, if you're not processing that input, it's hard for you to have an output, whether that output is a thought that you have to what you want to say to someone or to putting the pencil to paper of what your thought is for what your assignment is in first grade. And so,
So can I slow that down for a second? Because I want to make sure everybody understands what you just said. So I get that there's a nervous system relationship to the hierarchy of our brain's ability to learn, right? And then what you talked about regulation and correlation. So sensory process, we talk about kids with complex issues as having self-regulation issues all the time. And what you're saying is it's not just the behavior of did you act out or misbehave or follow through with what I asked, but it's a lot of internal self-regulation that you're talking about.
Yeah. So our children with regulation challenges typically have a sensory integration issue. So if your sensory profile is craving something all day long and you don't get that, you're going to be dysregulated. When
Can you give an example of what somebody might be craving all day long?
if I don't feel my body in space really well, I might be seeking, like what you said earlier, proprioceptive input, pressure, or vestibular input. I might be rocking or spinning or flicking things to visually stimulate myself. And I am essentially, as a child, I'm kind of grasping at straws environmentally to find something that gets me more integrated and more regulated. And so
Mhm.
that's kind of where we look beyond the behavior, because every behavior is a form of communication. And
Yeah.
so typically it's a sensory need that's not being met for that particular person's sensory profile. So as an OT, what I look at is, what is this little person's sensory profile? And is it getting the nourishment it needs neurologically every day? Does it get the movement? Does it get the pressure? Or is it too sensitive and everything bothers it? For
Yeah.
auditorily or tags in your shirt, every people can be hypersensitive or hypo, which means they need it more. And so
Okay.
that's kind of what I do, is I read what the nervous system is telling me and then create experiences to get them more integrated. Once something's more integrated, then they can have more reactions that are appropriate.
So what does it mean to be integrated? Like, help me understand
So
that language, because that's a very, like, OTs know what you mean when you say that, and we parents are
yeah,
like,
when someone's integrated, it means that they are at baseline, have a really good optimal level of arousal. It means that they can sit and attend. If you're familiar with the zones of regulation, you're in the green zone. You're available, ready to learn. You're not too overstimulated. You're not anxious. You're not overly excited. And you're also not lethargic and kind of slumping around, right? So you're in that Goldilocks zone. So when you're integrated, you have a Goldilocks zone for arousal, and then you can act upon that arousal level and do what you need to do, whether that's play on a playground, listen to your teacher, pick up a pencil, put it in your backpack. You're not distracted by the basic need of your nervous system wanting something else, whether it's rocking or moving or whatever it might be. You're being distracted by something that bothers you.
so we see a lot of the autism world, the tendency to put on headsets, to, reduce stimulation, turn down lights. Is that helping for regulation, or is that just accommodating the problem in the first place?
It's both. It's so the accommodation is helping regulation. And so that's the balance that you look for when you're working with a child, of the accommodation that you're providing. Is it appropriate for the environment? Can they still do everything they need to do?
Mhm.
And a lot of those accommodations work really well for a lot of kids.
Beautiful. Okay. So thank you, because I think that sets the stage, because OT is really fundamental and can be complicated for those of us who really
Yeah.
aren't familiar with it.
Absolutely. I think it's OT's like a double-edged sword. It's a blessing and a curse of what we do. It's hard to explain it, even though it's really simple and it's very functional. It's almost
Like that too. I can relate to that.
Yeah, and so it's hard to explain. It's very abstract,
Mm.
and there's a lot that goes into it. So OT's always had that. The ability to explain what we do it's not like a 5-second elevator pitch in that way.
No, it's complicated, and but the simplicity of is that when you help a kid become more regulated, it's really extraordinary how it shifts their availability. I mean, I'm a big proponent of OT, and there are times where, because I talk to a lot of parents I've never met before, where I'm listening and what I'm hearing is, "Have you gone for an OT evaluation?" Like, I can just hear, and I can't put my finger on why, but I can hear when there is a seeking. The term I often use is when a kid is seeking,
Yeah.
seeking input of some variety.
Yeah. And those are those kids who are hypo responsive. Those are your seekers, right? They need and crave and want that. They're under the Goldilocks zone. And until they get that input, they're going to keep seeking it unless you give it to them in a more appropriate way for the setting. So you've got
Okay.
like seekers, and then you've got avoiders, and then you've got like kids who are a mixed bag in between different, you know, um, profiles within different settings. So
Beautiful.
it can
So you've got the seekers are going to be underregulated or hypo, and then the avoiders are going to be hyper-regulated and need to be kind of downgraded, if you will, downregulated. And then some people have both, depending on what's going on.
depending on the system, right? So you can be auditorily really sensitive, but seek a lot of vestibular input. So those are the kids that are like covering their ears and really startled with the fire truck, but need to be swinging and moving all the time, right? Or they're really sensitive to tactile, might be their clothing, they might not like that, or getting their hands dirty, but they seek a lot of proprioceptive input. And so they're constantly leaning on people or being really, their gradation of force is off. So every profile has a different presentation that's uniquely theirs. Mhm.
Beautiful. That was beautiful. So let's take a quick break and then let's come back and talk about brain and sleep. Okay.
Absolutely. Yeah.
Do you recognize current ADHD interventions fall short? At DIG Coaching, we have developed a new field of engineering and a new ADHD intervention called cognitive ergonomics from the inside out. To learn more, go to digcoaching.com/impact.
Welcome back, everybody. My guest is Dr. Marielly Mitchell, and we've been talking about occupational therapy and the sensory regulation and kind of why it's so relevant to kids with complex issues. And what we really want to move into is a conversation about the sleep and breathing. And you have this kind of insight from how you see your lens of OT. Talk to us a little bit about what's important about that for our community.
Yeah. So the thing is that, like what we were talking about earlier, is every child has their own unique sensory profile, right? And our children with different diagnoses, a lot of the times their sensory profile might already be a little bit more at risk to having challenges with processing sensory input. And so that's a neurological process, right? Sleep and oxygen and nitric oxide and the amount of sleep that you're getting, the level of your sleep being restorative is biological and physiological, but it can exacerbate how things present neurologically because the brain struggles when you don't sleep well, especially in a developing mind. So if you've got kids who wake up at night, who snore, or they're grinding their teeth, or have nightmares, wetting the bed, these are all symptoms that the brain is having a hard time while that person's trying to really have good restorative sleep. We essentially heal when we're sleeping. And so when we're not sleeping well, with a lot of our diagnoses that we have, ADHD, ASD, that's kind of one of the things that goes along with the diagnosis. It can really exacerbate what you're seeing neurologically and turn in the intensity of the symptoms quite a bit. And so we as a clinic, we really specialize in bringing those two worlds together and making sure that kids are always breathing through their nose while we regulate them from the traditional OT perspective and making sure that their airway is open as possible and is growing in the right direction so that their jaws grow forward and outward and not really narrow and tiny. So that's kind of what we do.
So as a mom of young adults, a part of me is trying really hard not to panic. Well, and myself, like I couldn't breathe till I was 12 because I was an allergy kid back before, that was as well managed. And one kid's a mouth breather, another kid's like, I'm hearing you describe this and I'm thinking, you've just described all of my kids' entire childhood. Mm-hmm. So I know I want to talk about kids, but can you give me a moment of it's not too late or it's not a crisis if they've hit older years?
Yeah, no, you absolutely. You can always work on this. I have a dentist here in LA that the latest patient that they worked on was 96. The person developed sleep apnea and wanted to address that. So you can work on this, especially for females too, because our bodies are more flexible because of our hormones and childbirth, that we have a lot more dynamic movement through the rest of our body. Everything's connected, right? So what you want in the lips, you get in the hips. And so the younger, the better for addressing it, but you can absolutely work on it. Every patient is different. So it's something that I do think if people are noticing that they're having a challenge with their sleep and it's impacting their day-to-day life, it's something to definitely prioritize, I would say. Because sleep really is, as we're starting to understand with technology, it's so critical to our overall health and wellness. But yeah, I think you can definitely address this as you get older. When I learned about this like 10 years ago, I had all my own challenges. So this is very like near and dear to my heart. I had reconstructive surgery of my nose. I've had an expander in my mouth. I was like 30, 32. I still need to do it, expand again. But, it's something that I prioritize and it changed my life. So yeah, you can do it when you're older.
Yeah. No, when sleep apnea was discovered as an adult, it definitely changed my life. Mm-hmm. So let's go back to kids. Like, what do you want parents of younger kids to understand? Because I hear that if you're older and you're kind of more fully cooked and developed, like there's some consults that you might consider if you're breathing through your mouth, if you're noticing sleep interruptions, that kind of thing. Let's talk about kids.
Yeah, I would say so. Something I think that should be kind of like understood is that you should always be breathing through your nose unless you're talking or eating. Really, you're not supposed to be breathing through your mouth. When you breathe through your mouth, there's a few things that happen. First, your brain perceives that as gasping. So it makes you more dysregulated. It puts you in fight or flight, which for our ADHD, ASD population, sensory kids, that's not something that, they can really afford to have more of that kind of neurological tone. It's not something that works in their favor. In addition to that, you're ingesting germs, you're ingesting a lot of things in the air, dust, allergens, etc., which when you're breathing through your nose, you have filters for that, which is great. And you have a microbiome that neutralizes those kinds of viral loads and bacteria so it doesn't go into your body as opposed to straight in through the mouth. I call it like the oral portal, like it just stuff goes in your body. You don't want that. And so if a parent notices that their child's breathing through their mouth, I would try to educate your child and attempt to keep their nose really clean. Some kids, you can just really keep their nose clean. If your child is having a hard time blowing their nose or doesn't like you touching their nose, desensitizing that nose over time is a good idea. So you can eventually it's like toothbrushing. You want to get in the habit of that and keeping their nose really clean so that it can work. And then if a child still has those challenges, I would recommend people going to their pediatrician and getting the airway evaluated and looking for an airway-centric dentist is a really good option because there's a lot you can do, especially before age 6, because about 80% of the jaw develops by then, where you can get really gentle expanders to help the direction of the jaw growing so everything has the room that it needs to. And it can be supported to close well. And also if you need to do therapy, then you can work on like the strength and endurance of the mouth too. And every case is different. Not every case needs therapy. Not every case needs expansion. So it just depends on the child.
What are the kind of symptoms, if you will, that parents might be looking for to see that something that's happening during the day may be impacting the trouble kids are having at night?
Yeah, so during the day, you'll see excessive drooling. You'll see chapped lips is another one. They'll have like that red ring around their mouth a lot of the times because their lips are really dry. So then they lick their lips and then the skin barrier gets compromised. You can also have halitosis, which is bad breath because the pH balance of the mouth changes due to the air coming in and drying the mouth. Sometimes these kids will also have a tendency to have reflux more because they are swallowing air all day. So their little bellies get full. So it's kind of this like vicious cycle that they kind of get into. And then they can also be more dysregulated during the day, or they'll have like allergic shiners is what we call them, where they have really like puffy or darkness under their eyes. It's because fluid's not moving in their cranial region. Things if the mouth is just open, the mouth is not really being used a lot. They're probably weak there. So they're not chewing things. Things aren't like pumping and dumping in this region. So they tend to have more fluid buildup in their face or puffiness here, or like you can see poor circulation. And so those are also some clinical signs during the day. And these kids tend to be a little bit more dysregulated. I have my kids who are like tired and wired and present more as hyper. Is that kind of the word that they would use? And then my kids who are falling asleep at circle time and they're really tired. If you've got a 6-year-old who falls asleep every day after school, like that's something to kind of, and most parents know if you're thinking about something like your guts are, I've never had a parent really bring something to my attention and, over. Yeah, your intuition's right as a parent. Like if you're thinking something, parents are typically pretty accurate and they're like, I don't know about this. And then, looking for people who are airway centric is important in your community. So airway centric dentists are a great starting point for families, I would say.
Interesting. All right. So before we go there, I want to go back to drooling, chapless. A lot of kids especially sensory related kids, will chew on their clothes. Is that an indication or is that something else that's going on?
That actually can be one. Yeah. Because what's happening is that child's trying to breathe better. So they open. But what happens is that, and they're also getting sensory input to their jaw, right? So it could be both or it could be one of them. But what happens is when they chew on these chewies, they're perpetuating an open mouth posture, which can be more dysregulating and making them want to chew more. The same with like nail biting or hair sucking or needing to have something in their mouth all the time. A lot of the times when you eventually meet those sensory needs and then teach them to breathe through their nose and close their mouth, that satiates a lot and it actually stops. So, but your tongue is supposed to be suctioned to the roof of your mouth like this to give you deep pressure. It's like the weighted blanket in your mouth. So when children don't have that, they're grasping at straws.
So the tongue is kind of flowing in the mouth instead of pressing? Is that what you're saying?
Yeah, it's not giving the sensory input to the roof of the mouth like it should. And so there's other habits like thumb sucking, pacifiers, bottles, etc. do that as well. And so when they don't have things like that, they kind of will use what they can environmentally, their shirt, their hair, their fingers, things like that. But their tongue should be providing that input to the roof of their mouth. And
Everybody else listening right now, pushing your tongue to the roof of your mouth and trying to assess how often you do that. I'm just saying it's
yeah, yeah, and that's where your tongue should be.
closure.
My tongue should. That's where everyone's tongue should be. Is suck. Your tongue is your natural expander and retainer. That's what it is.
So
It's
you're not pushing your teeth. You're actually supposed to be doing that.
mm-hmm. So your tip of your tongue goes where you say the letter N, and then the rest of your tongue should suction to the roof of your mouth, and then your lips should close gently without clenching. And that's like a weighted blanket in your mouth that gives so much sensory input to the roof of your mouth and also acts as your natural expander and retainer to sustain the space that you should have there.
Wow. I mean, and just hearing that and trying to do it and realizing I don't do that all the time. Is it
Mhm.
do we typically do it and we don't notice it, or do we actually have to train ourselves to do it?
That's a good question. So it depends on like your epigenetics and kind of what your oral history was in infancy. So if you think about in America, there's not enough maternity leave, right? That's not something that's embedded in our society. It's a system issue. And so if you think about children in like more indigenous cultures in like South America or like Africa, they have really wide jaws and all their teeth, right? From infancy, they kind of are breastfed and then fed in like real like actual food, and so their jaws develop, and so you're with that background, everything should work as it should, and your tongue has enough room in the roof of your mouth. But when other things are introduced, sometimes it's just because of physics, but bottles and pacifiers push the tongue down and away, and can sometimes create more narrowness in the roof of the mouth. And so it's just what happens from a force perspective, because the tongue's actually quite strong and babies are so malleable that sometimes that can make the roof of the mouth, which is the floor of the nose, too small for the tongue. And so the tongue has nowhere to go but down. And that can contribute to an open mouth posture. So theoretically, we should be able to have enough room for our tongue. But sometimes historically, there's been things environmentally that can kind of make the mouth a little bit smaller. And then also some people are also just genetically more predisposed to having a more petite jaw shape, which then that can obviously make less room for the tongue.
Yeah. So let me tell people how they can find out more about you. And then as we begin to wrap this conversation, I want to ask you to kind of think about what do you want to leave parents with? What is it that you want to make sure? Because we've got parents listening with kids as young as, maybe 3 or 4, but also as old as 24 or older, into their 30s. So just reminding everybody, our guest is Dr. Marielly Mitchell. And you can reach her at theraplayla.com and Instagram, Dr. Marielly, all spelled out, where there are resources and free gifts and all kinds of resources there. And it will all be in the show notes so that you can find her quite easily.
Mm-hmm.
Marielly, this is fascinating. And thank you, because I've learned a lot and I always love it when I get to learn a lot. What do you want to leave parents with who are listening? Like, is there something we haven't talked about that you want to make sure we hit, or is there something you want to kind of reinforce?
I would say for parents, I empower you to trust your intuition and your gut. And if you think something's going on, then to find people that would also investigate a little bit further. And if something that you're doing isn't working, to definitely look into sleep and airway health. Obviously, nutrition and elimination is also really important, but sleep for neurological conditions, I really believe in honoring biology and physiology before we go to like neurology and psychology. I really think that a lot of kids with are some of our like neurological diagnoses, that their sleep impacts that a lot and the severity of their symptoms. And it's something that can really be optimized that I think a lot of people don't know that yet. And it's definitely more on the cutting edge, but optimizing the airway is an amazing way to help the nervous system function as best as possible. So,
and you can do that during the day as well as at night.
In terms of, you can definitely, you can do the therapy we do is to help people learn where to put their tongue and keep it there morning and night. Because when the tongue drops into the airway when they're sleeping, that can make the sleep less restorative. So they move around, they grind their teeth, they snore, all that kind of stuff. It's kind of like the baby cousin of sleep apnea.
Beautiful.
Mm-hmm.
Wow. So much here. So much to learn. Thank you. I really appreciate it. And I'm really glad you have had these insights and awareness and that you're bringing it forward to the world because it's really important. And it's not something I've heard a lot of people talking about over the years. So thank you. I really appreciate it.
Thank you. Of course. Thank you so much.
Before we tune out, do you have a favorite quote or motto that you want to share with the community? Just for the fun of it?
Yeah, yeah. I mean, on truly just biology and physiology before you go to like neurology and psychology. Like really, like I really think that there's a lot of things that are you can optimize for our populations that can really help with their overall neurological function. And it's something that I've seen time and time again. And I encourage families to look into those things.
Beautiful.
Yeah.
Well, thank you. Again, thanks for being here and thanks for what you're doing. To those of you tuning in and listening, would take a minute and think about what's the insight you're taking away from this conversation. There's a lot of information. So maybe what you're taking away today is information, or maybe it's information that you want to apply, some awareness you have. What is that? What are you aware of now that you weren't aware of 30 minutes ago? And what do you want to do with that information? How do you want to apply it? Is there a provider you want to talk to? Is there a conversation you want to have with your kids? Is there some curiosity you want to bring to your family dinner table to talk about what you've learned? Like what's coming up for you and what do you want to do with it? And as always, folks, thank you for what you're doing for yourself and for your kids. You make an extraordinary difference. And I love Dr. Marielly's message. Trust your instincts. You know better than anyone. And sometimes it's really hard for us to remember how important it is to trust ourselves. So I'll leave you with that, and I will see you in the next conversation. Take care, everyone.
Hi.
You've been listening to the Parenting with Impact podcast with Elaine and Diane. For more information on the Impact Parents community or to join Sanity School for Parents, please visit impactparents.com. If you like what you've heard, please share this podcast with friends who need similar guidance and subscribe wherever you listen to podcasts.